Kelsey, what should parents do if they suspect that their child has a concussion?
Well, one of the first things that they should do is to keep their child from playing. So don't allow them to practice or play in any games until they seek medical care. Because one of the most dangerous things that can happen for a child with a concussion is to get a second concussion quickly before their brain has had time to heal. So they should stop them from playing and seek medical care from a doctor. And then you also want to let the child's coach know that they had a concussion, because a lot of times the coaches are not aware of the situation, and they should know that their child should be able to rest and take breaks if they're having any symptoms.
Can you briefly explain what a concussion is and how it affects the brain and the child's activity? And then we can discuss also some of the signs that parents can look out for.
Sure. So a concussion is an injury to the brain that can happen from the brain moving around inside the skull. So it can happen with, getting a hard hit to the head, or sometimes even just a hard movement with the neck that causes the brain to jostle in the skull. So every concussion is a little bit different, which makes it difficult to treat at times. That's why you can't have a specific protocol for somebody who has a concussion, and it can often be difficult to determine a timeline for when people will feel better. So different systems can be affected with concussion: the oculomotor system, the vestibular system, balance. A lot of times their cervical spine or their neck will have a lot of pain. So what we try to do at Wendy Webb Show and Well Physical Therapy is to figure out all of the impairments and look at the whole picture of the concussion and give appropriate exercises depending on what the person is struggling with. So we might give them visual exercises to help with their reading, or we might give them, coordination and proprioception exercises if they're having difficulty with balance. We might work on their neck a little bit to try to help to address some of the symptoms of neck pain. So it really is a very individually tailored approach depending on the person.